So let me introduce myself. So I'm Fred Tilekor. I'm a sports physiotherapist and osteopath. I'm working with Winback as the president of the Winback Academy. So I'm in charge of the different all the educational aspects. I also work directly with the R&D to help them to develop the products and to test the products. And Bastien is also with us on this call. So Bastien, introduce yourself.
Yes. Hi, everyone. I'm Bastien. I work on the R&D department. I'm scientific affair and project manager for Winback since 4 years. And some people know me, and I'm support sometimes after sales service and quality department.
Okay, so we would like to start with this new study. Arno said, it's a study that we have done with the most famous lab that we have in research in France. It's an in vitro study. So that's a fundamental study that we have done with the BAC4. And I let Bastien present directly this study.
Yes. So for this part, there is a study to prove the theoretical and fundamental basis of TECAR therapy. This is the first step with in vitro and some phantom I explain later. This is the first step for this study. The second step will be a study on cellular, on fibroblast cell and muscle cell. And the third step will be on human, so clinical study. So for this first step, we worked with a laboratory, in France laboratory, biomedical imaging laboratory in Paris. And the objectives are, there are two objectives for Winback is to characterize the different layers of the skin and muscle and validate the theory of TECAR therapy. And the second objective for the lab is to evaluate and explore new ultrasound imaging technicals. We work with phantoms. Phantoms are gels composed of agar-agar and salt, and it mimic the dielectric characteristics of skin and muscles. This is the first step before continue on the cells to obtain the bioimpedance properties equivalent to muscle tissue. And as you can see on the two picture, this is the phantom, the gels, and the lab put an ultrasound device to have the feedback on the amplitude of the heat. So for the first experiment, we work on the influence of CET intensity on heat capacity. So for the first experiment, we compare the intensity of 40% and 80% for the soft mode. So as you can see on the picture and the video, at 80%, we see that the amplitude is higher than at 40%. So it's the first theoretical validate with the higher intensity, the higher amplitude and higher heat we have. The second experiment was to look at the influence of the frequency of the CET. So the lab put on some different positions the probe in high positions between 0 and 3 centimeter, and in the middle of the phantom at between 3 and 6 centimeter. And after they compared between soft mode and deep mode. So as you can see on the left, they compare set deep and soft in high position, so between 0 and 3 centimeter. So on the right, set at 80% in soft, in the high position, you see a higher amplitude of heat, more intense in soft mode. So it validates the soft mode the soft mode in a layer between 0 and 3 centimeters. And on the right, he put the probe at between 3 and 6 centimeter, and we can see at the left. So for the probe in the middle of the phantom, the heat is more intense in deep mode in depth. So with this experiment, we validate that the soft mode, so at 500 kilohertz, is more effective on the surface. And for the deep mode, at 300 kilohertz, it is more effective deeper. Okay, so this is the same experiment, but we can see on the curve the difference between the amplitude of the heat between the deep mode and the soft mode. So at the left, we can see the difference between set soft vs deep mode with the probe in surface. So the curve in red corresponds to the soft mode. So the amplitude is higher than the deep mode. In the middle, the graph in the middle, we can see that the deep mode, so the curve in red, the deep mode is more effective deeper. And on the right, you can see the set soft mode by putting probe higher and middle of the phantom, and for the soft mode, the amplitude is higher when the lab puts the probe on the surface.
There's
some question.
Why it's not working in French? It's just because I'm sorry, but we already did it in French 2 weeks ago, so now it will be in English tonight. And I don't understand why Mircea you have no screen shared because I think everybody is watching our screen. So I think it's from your part and not from ours. I'm sorry. Um, so yeah, in conclusion, Bastien.
Yeah. So in conclusion, so we validate that the frequency of the currents influence the depth of actions. So in soft mode, the effect decrease with the depth, and in deep mode, the effect is greater when the depth increases.
Okay.
The last experiences will be on the RET. So to compare the RET resistive mode with the resist. Yes.
Because there is a question just regarding the first experience. Question regarding the amplitude of this graph. How does it correlate to the Celsius degree?
Mm.
Question-réponse.
Sorry.
In the
Question
second
regarding the amplitude of the how does it correlate to
the second study, so that's on the
okay. This is not really the Celsius degree, but the amplitude of the heat. The lab explained us that the calcul method will be only related to the amplitude of the heat, and they explain us that is correlate to the Celsius degree because more the amplitude of heat, more the amplitude is, more there is Celsius degree. I don't know if I
yeah, it's just
respond
because
to the question.
they measure just the fact that we increase the temperature by the ultrasound. So they were not able to measure it like with the temperature. So that's why it's just a curve, and they can see. So if you remember the video just before with the red that we can see, so that's how they can see that if it's more red, it means that we have more. It's higher on the temperature. So that's just like this, and then that's why it's difficult right now to have an exact temperature. So that's why we don't put you the temperature, but you can understand that it was just to prove just basics, fundamental knowledge that we always explain when we speak about the TECAR. Sebastian is asking on my back SE3, there is only CT on CT deep. What is the difference between soft and soft mode? So now we speak about soft and deep with the new generation, but it's exactly the same as CT and deep CT. CT soft is just CT in your old generation, and CT deep is the CT deep. So because CT soft is 500 kilohertz, so that's the CT that you know, and the 300 kilohertz is the CT deep.
No, they didn't, to respond to Chris, they didn't measure the temp in the test because they don't use a temp probe. They use a specific ultrasound that only measure the difference of the amplitude.
On Max, yes, we don't have the study on human body because we told you that that was the fundamental study that we did. It's an in vitro study.
Mm.
And the second step will be in vivo, but we had to start by the basics. So we had to start by the in vitro to calibrate all the machines, to calibrate all the results first. And then because the lab, they don't know us, you know, they don't know our technology. So that's why they need to start with something which is really simple for them. And so that's why they choose to use some phantoms which are really easy to control. After that, because now they see that with the at 500 kilohertz, it's different than at 300 kilohertz. We have different depths, so that's something that helps them to create the new protocol. Because if we go directly in vivo, that will be too hard to calibrate their measurements. And now in the second step, so that's the new study that we're going to launch, we will be able to work on in vivo, and we will have some measures on the human body.
We have a range, Fred, about the temperature, or that's too early to talk about it?
No, we don't have any. I mean, you can see that, for example, that's the we can compare the difference between the CET at the same frequency, which is the in this graph, for example. So you can see that they were at 0.01, and the other one was at 0.05, let's say. So we can almost say that we have the double, but it's just a comparison between each curves. That's the only thing that we can do, but it's too hard for them to enhance any temperature and temperature judgment. That's where it's really basic, but
Okay.
again, that's why we have to do a second step.
Okay, and then another questions from Tyler, like mentioning that actually, you know, the key takeaway from this experiment is to prove like the differences of use between the deep set and the soft set, basically. That's correct.
Yeah, because you know, usually when we speak about TECAR, I mean win-back TECAR, we always say that if we use one frequency, which is 500 kilohertz, where we are the most effective is from 0 to 3 centimeters, and then when you click on deep, then you will be more effective on from 3 to 6. So that was something that we were just saying, but we needed to prove it first. So that's what we did in this experience, just to show first that when you increase the intensity, you increase the effect, you increase the temperature. On the second step of this this study was just to prove, okay, the influence of the frequency. So we always say that lower frequency goes deeper, and now we are able to prove it directly with this this experience. And then the third experience on the RET, Bastien.
Yes, the third experience on RET is to see if the RET resistance mode has an effect of the resistivity of the tissue. So the lab used a phantom containing a bone in its centers and another phantom without bounds. And the parameter used were RET at 90% plus high tense mode at 25 Hertz. So you see on the left the image with the bone on the white, yes, and on the middle the phantom without bone, and on the right there is the video. So you can see on the left video the bone, the intensity of the heat is higher on the left, the phantom with the bone, compared to the phantom without bone.
So that's almost the same image. I mean, on the left side, it's on gray. On the other one is in video.
Yes.
But we can see exactly right here. You can see the bone. So the chicken bone is right here.
You use a chicken bone.
So that's just right here.
And this is more intense than the phantom without bone. And as you can see on the curve, there is a big difference between the amplitude of the heat with the phantom with the bone, the blue curve, compared to the red curve without bone. And the lab found that after 5 minutes of eating, the amplitude at the bone level is almost 7 times higher than the phantom without bones. So with this experience, we proved that there is an increase in the temperature localized at the bone level. So the RET mode is useful for resistive tissue.
So just to go back to the question about the temperature, so you see, that's why we say 7 times higher. So we don't have any real temperature, but we can say that, okay, it's 7 times higher than without the bone. So that's just the experimental studies are always like this. It's just experimental. So we have the data, and then we can say, okay, it's 7 times. After that, maybe the temperature won't be 7 times higher, because we have, if we speak about the human body, you have all the regulations, you have the vasodilatation and everything, so you will fight against this temperature, but against this heat. But right here, it's just in vitro, so that's why it's so high, 7 times higher. But again, that's why we can give you any real temperature, but you can understand that, yeah, we just proved the most resistive is where you have where the resistive current is going to be focused.
Yeah, I mean, to your point, we have a comment from Christ, sorry, and saying that actually, this is the same principle when you apply and you push on tissue and becomes warmer. So this is it, when we talk about when you increase the resistance, that's where the energy is going to focus. This is exactly what we prove here with this experiment. Where we have more resistance, you have more concentration of the energy.
Yeah, I remember when we speak about resistive current, you have different ways to increase the resistance. You can increase passively the resistance like the bone, but you can also increase the resistance actively, just ask to the patient to do a contraction, or you can just put a pressure from the outside. I mean, with your hand, you can put a pressure, and then with this pressure, that's where you will accumulate the energy on the pressure, on the resistance. So that's the key when we speak about resistive current. Always think about the resistance. Where are the resistance, or how can I change this resistance?
And that was something that we observed, and that was more our also like a clinical observations about using, for example, the IEMS current for muscle contraction, and like focusing the red current on that contraction. So then we can really target the deep tissue and the deep muscle by doing so.
So as we explained this study and experiment was to validate the theory of TECAR therapy, and for us it is important to, as Frederick said, to calibrate to do some future cellular and clinical study. So we validate the action of the resistive mode for resistive environments. We validate the difference between the frequency of the CET and the difference between the intensity. And in the long term, the objective will be to verify the effects in vivo and in human. There is finally the goal of the lab and Winback is to collaborate to have a potential to detect some disease affecting the electrical permittivity of tissue, and for example, to locate an abnormal accumulation of fat tissue compared to a region rich in water, because this is with the measurement with the lab, it is possible to detect the difference between impedance of some abnormal cells. So this is a future project.
Okay.
Before to the next part, do you have any question regarding the first part on this theoretical study?
Okay, I think it's good.
Okay.
So again, for those who are just arrived, you will receive the replay tomorrow, and you will have the QR code to have access to all the studies that we're going to show you during this presentation. Like the first one that we just showed from this French lab, you can have access to all the data and everything. And that would be the same for all the studies that I'm going to explain you. We wanted to do this this webinar because, you know, it's always the same when we speak about TECAR radio frequencies. There are a lot of people who just say, well, okay, but where are the evidence? So we wanted to show you that all the evidence are here. There are a lot of publications now. We just look at all the studies from 2020 to 2024. And you will see that there are many studies in different aspects, physiological, cadaveric studies, placebo studies. So there are different studies. You see, so that's all the studies that we have found. So again, you will have the time tomorrow to watch all the different studies. So you get some studies in pain, about pain. Some we just was about looking at the energy or the amplitude. I mean the range of motion. Some of them were just more about the discomfort, the flexibility, the thermal changes, blood perfusions, aesthetics, and some of them were just, they just said that they don't have any effects, and we will see why maybe they found that they don't have any effects. So let's start with all the studies that we found about the physiological effects. This first study was just a meta study. In this meta study, they just in the literature, they just put all the studies from December 2021 to April 2022. And they just say that the TECAR therapy, I mean, no, that's not the meta one. The TECAR therapy combined with high intensity laser and manual therapy in the treatments of muscle disorders. So they just put a review about to compare the laser, manual therapy, and the TECAR therapy. So what they observed and then what they said is with the TECAR therapy, they have a better blood circulation, which eliminates the inflammatory catabolites. They also measured that they increased the collagen tissue extensibility and the stimulation of drainage. So that's all the observation they did in those different studies compared to the laser and the manual therapy. And their conclusions was to say the TECAR therapy combined with manual therapy presented an optimal collaboration in the recovery process of all muscle disease. So that's the first one that we saw to speak about the physiological effect. So that's exactly what we say. I mean, better blood circulation, better drainage, increase the collagen. So that's the fundamental physiological effects that we always explain that they just described. In that one, in this study, they observed the effects of the capacitive and resistive energy on musculoskeletal pain. So it's a systematic review on meta-analysis. With this one, in this meta-analysis, which is good, is that they say that there is a positive effect on pain after 4 weeks of intervention. So that's good because that's really in a long-term effect. And they saw that we have 3 physiological effects: antispasmodic, analgesic, and metabolic, which is most of the time what we say about TECAR therapy. What they said is the TECAR is higher, the effect of the TECAR is higher than the laser for pain relief in the low back pain. So which is good because that's also sometimes the question that we have: what is the difference between the laser and the TECAR therapy? So in this meta-analysis and the systematic review, so which is a big one, they say that we could have a better effect on the pain with the TECAR. And the conclusion of this meta-analysis is to say our results provide an appropriate evidence for the efficacy of TECAR therapy on musculoskeletal pain. Therefore, TECAR therapy can serve as complementary treatment to physiotherapy. The limit of this meta-analysis is the number of articles and the quality of certain studies. So to be clear with all of you, that's sometimes what we can see when we look at all the different studies that we have. Sometimes there are a lack of quality on certain studies. I really like this one because with this one we have a lot of studies, a lot of articles, because it's a systematic review with 276 articles, and 75% of those studies use a similar frequency range. So you can see the range was from 440 kilohertz to 600 kilohertz, because that's also some questions that we have, because most of the first studies have been done by Indiba, to be clear, so at 448 kilohertz, and sometimes we hear that it's the only frequency which is working in TECAR therapy. And now we can see that with those new studies, there is a range of frequency from 400 kilohertz to 600 kilohertz. Sometimes it's with 1 megahertz. So we have different frequencies. So I think we are in the good way to use different frequencies. Because as you just saw in the first study that Bastien showed you, we have tested different frequencies just to show that we have different depth. And to go back to this meta-analysis, I mean this systematic review, they observed two different points. So the first one was they saw that we could improve the strength and function. And the second point was they observed that there is a reduction in pain intensity after treatment. And the conclusion was the TECAR appears to be an effective therapy for reducing pain and improving quality of life and the disability in patients for musculoskeletal disorders.
Mm. I think there is a reaction from Chris saying that sometimes he put like some blood pressure cuff on the tissue rupture to increase the blood circulation in this arm and to start to make the movements with the hand. So I think you referred to the previous one, and yeah, I think that's the right way to go.
Yeah, sure. I mean, because we know that we can change we can accelerate the blood flow with the TECAR for sure. After that, I think for me, just my opinion, I would prefer to use the BFR without the TECAR, but maybe we could use the TECAR after the BFR session, just to restore all the vascularization after the treatment. So after that, I just noticed 4 different studies that have been done in cadaveric studies, and in different areas. So the first one has been done with the capacitive and resistive, but on the shoulder. The second one was done on a chronic elbow tendinopathy, but that's just fun to say it's a cadaveric, so they have chronic elbow injury. But they just found those dead bodies with chronic elbow. I'm quite sure they're not dead about that, but that's just fun. And the third study was about treating the knee. And the fourth one was to measure the effects on the Achilles tendon and the muscular tendon, the junction between the gastrocnemius muscle. And you can see all the different pictures, the photos to illustrate exactly where they apply the current. And after that, all these studies, they use some internal measurements to measure the temperature. They have current analysis, and after all the time, they used capacitive and resistive. What they observed is there is a significant increase in the tendon temperature, both locally and remotely, depending on the current. They also observed that they could increase the temperature inside the capsule. And with the low intensity in resistive mode, they saw that there were no thermal effects. But what they just conclude is that could be useful for the proliferation of the tissue, because they just measure that with the RET, when they put the current from one point, they receive it on the exit point on the ground plate. So that's why they speak about tissue proliferation, because that's where we could transfer the energy from one point to another one. When they tested the high intensity capacitive in the posterior superior position on the shoulder, that's what we see here right here. What they saw is there's no significant differences in temperature changes on the glenohumeral joint, capsule, or supraspinatus tendon. So they just what they say is even you put the CT on the anterior part or on the posterior part, that could be exactly the same about the glenohumeral joint, the capsule, and if you put it, because the supraspinatus is a superficial tendon, so that's why we can see that we can increase the temperature on this tendon. And the last study that's about the physiological measurements and also more specifically about the temperature. In this study, they have used the CT on RT. As I told you, it was on the tendon junction of the gastrocnemius. And they used 4 different applications. The first one was with the high intensity in CT, so that's the blue curve. Low intensity CT in the orange, light blue for the high intensity RET, and the yellow for the low intensity RET. And what we can see is for sure it's when we put a high intensity of RET, we can increase more the temperature and it stays a little bit higher longer compared to the low intensity CT, which is the one which will increase the less the temperature. And remember that's how we create this thermal effect. It's about the ions that we have between those 2 electrodes. It's an alternative current, so it means that the ions will move from one electrode to the other one at the frequency that we have selected. So if we imagine that we have like 500 kilohertz, it means that 500,000 times per second we alternate the polarity, so the ions movement will be very fast. The negative or the positive will create like a friction, because that's the movement which is between those 2 electrodes. So this friction will create the heat. So that's always important to explain to our patients that the heat is created inside the body. Saludos de Venezuela. Saludos. So in conclusion of those 4 experiences that we saw in cadaveric conditions, when we use CT low intensity, we create a low surface temperature rising. So that could be useful for muscular or tendon acute conditions, because we just create a little bit temperature, a little bit heat. But if we use a higher intensity in CT, in that case, we create a bigger heat. That may be more useful for the chronic conditions, to work more specifically on the viscoelasticity, because that's superficial, and we can work on all the elasticity of the tissues. If we speak about the RET, if we use the RET at low intensity, in that case, that's where the conclusion of those studies were going to speak about cell proliferation. So that will be useful in acute conditions when we speak about healing process, accelerating the healing process. And then the last test that they did with the RET in high intensity, that one will create a big hit inside the joint. So that's why it could be useful to use the RET in high intensity for the periarticular thermal effect, also to help for the viscoelasticity all around the joint. So that's where the RET is useful. Again, that's also something that we tried to replicate, to duplicate with this study that we've done with this French lab, with the CT and the RET with the bone, the chicken bone. So that's in the same way.
So to answer Nina questions, so this one is the conclusion of all the study that was mentioned about the cadaveric effect. So that's the conclusion of the different studies on the shoulder, on the elbow, on the knee, as well as on the tendon.
Yeah, that was just to resume the four studies, the four conclusion, to make it simple for everybody, because they tested, as I told you, they tested always the CT and the RT on. They almost did the same experiences with the low intensity CT, high intensity CT, low intensity RT, and high intensity RT. So that's why we could put all those conclusions in one big conclusion to make it simple for everybody. And to stay on the heat effect on the body, this study was looking at they were looking for the application of the TECAR therapy effect. Does it affect the temperature and the perfusion of the skin on the muscle microcirculation? So that's related to the question that we have just before about the blood flow restriction. So in that one, in this study, they observed that when they use capacitive and resistive, they have an effect on the local flow, intramuscular, and also on the cutaneous blood flow, so all the microcirculation. What is important also to notice is they don't have any effect on the heart rate because it's very local. So that's why there's no influence on the heart rate because we don't need to compensate this blood flow, local blood flow action. And they noticed that they could have a significant effect on the cutaneous temperature. And that's why the consequence was to increase the blood flow locally again on the inside the muscle or on the skin. Okay, oops. So that was some fundamental studies on physiological studies to observe in cadaveric or in vitro, in vivo, what was the action of the CT on the RT. And now let's move on the studies about pain. So we have a lot of studies about pain. So this first study that we selected is about using the capacitive and the resistive in postpartum pain for the woman after perineal trauma. What is really good in this study, it's a double-blind study. So maybe, Bastien, you could explain us what is a double-blind study for everybody?
Yes, the study in double blind is very interesting because both patient and the statisticians will not be able to see if one of the patient is on the study group or the sham group. So it's limited some bias. So in double-blind study, this is very interesting because this is more significant. This is more statistical significant.
So that's why, because when we speak about pain, it's really important if we could have a double-blind study to make sure that there's no placebo effect. There's no intervention from the therapist or the people who are just measuring the study. So in this study, they observed that they could reduce the pain on the rest at rest and also on walking, because that's the two measurements that they did, the pain at rest, but also on walking. And the conclusion of this study This study showed that the use of high-frequency current therapy could have a positive effect on reducing perineal pain and discomfort in the first few days following vaginal delivery with perineal trauma. So for sure, the limit of this study is the duration. It's a very short-term effect, but that's also the problem when you do that kind of studies in postpartum, because postpartum means we can do it just at the hospital. So that's why it's just during 2-3 days, and that's all. But if we speak about postpartum pain, we just have pills, drugs, and that's it. So that's where it could be really useful to put some TECAR therapy devices in that kind of hospital, because that's an alternative treatment compared to the drugs. Because if you have some breastfeeding, sometimes it's really not compatible. So that's where the TECAR therapy could have a very good place in those after postpartum treatments.
And this study will be done with the WinBack device, back one.
So that's another study which has been done also in postpartum perineal pain. It's also a randomized study, so it's a double-blind study. And it's almost the same. This one is a French study. The other one was, where was it? I don't know. But that one has been done in Marseille with the 1 hour equipment. And the results was the primary outcome was pain assessed at rest using a visual analog scale at day 2. And what they observed is that we have a VAS superior on 4. And but what is also really important is that secondary outcomes were including on day 2 the discomfort and the pain when walking and sitting. And also the second outcome was about the resumption of sexual intercourse after 30 days after the delivery. And what they observed, it was really more, I think it was really important about the secondary outcomes, because what they said is when the radio frequency was associated, we could see that there is less perineal discomfort when walking and less consumption of paracetamol after delivery. So that was what I was saying is just about drugs. I mean, if we could reduce the consumption of drugs with the TECAR therapy, that's good. I mean, we've done the job. So that's where, again, okay, it's just after delivery, but it's a short-term effect that they measured. But also, you can see that they just ask after that in a long term, because it's always difficult to do that kind of studies. But after with the phone call, they did it 30 days after delivery, and we can see that all the people were, most of the time, they were happy to have less perineal discomfort when walking.
Thank you, Anita. Also, so the previous study was done in Poland. So Anita recognized the the study. Thank you, Anita.
And the third study about the pain management, it's still a double-blind randomized clinical trial with 24 patients with the sham treatment. So sham treatments means they use the placebo treatments usually. And with this study, what is important is to see that they did it on low back pain, chronic low back pain, which is something which is really common for us as a physiotherapist. And the conclusion was they had a positive effect with TECAR in reducing muscle pain and stiffness. in patients with chronic low back pain. So that's good because it's not only the pain, but it's also about the stiffness. So they see that we have a higher stiffness. No, yes, they could reduce the stiffness, and which is also really important when we speak about chronic low back pain, because okay, we reduce the pain, but after that we need to get them to the movement. We need to be more active for the chronic low back pain. So that's where the TECAR is really important. We could imagine that we could use the TECAR before the active session, reduce the pain, increase the mobility, increase the elasticity, and then you could do all the exercises that you want with your chronic low back pain patients.
Thank you, Freddy, because I think this study, what we wanted to achieve also is to take like the studies with blind group. We believe this is the way that showcase the best the results in terms of TECAR.
And now let's move on in the third chapter about all the studies on cellular effects. So on those studies, that's really that's more the Bastion area, because it's some really specific studies. I mean, this study has been done on human keratinocytes, on fibroblasts. So that one. That's something that we want also to do in the future with Winback, to put some directly the electrodes in the cells
in cell culture.
Cells culture. And you see the conclusion that they did is TECAR current can promote the proliferation of human fibroblasts on the keratinocytes. I don't know how do you say that. As you want, take it. Which involves regenerative effects. And then they also say that the TECAR effects in skin cells, the promotion of early fibroblast migration, and slowing the keratinocyte migration. So what they say in the conclusion that could be they could prevent the wound chronification, because that's also what we notice is with the TECAR, for sure we could have some effects on the healing process. Maybe we're not going to accelerate the healing process, but we will have a good healing process. That means that we won't have any fibrotic tissues after that. So that's what we want to see with these cells studies. In that one, so they were about anti-fibrotic effects. So that's exactly what I was saying. They worked on fibroblast cells in contact directly with the electrodes. On the radio has an action on the extracellular matrix, which is good. And the other conclusion was they could lead to a decreased pro-inflammatory transcription factors. So that's something which is really important, because I mean, for me, to be clear, I always have a doubt about this anti-inflammatory effects that we describe. But I was happy to see that there is a study which proved that we could decrease these pro-inflammatory transcription factors.
The cell studies are very interesting to understand the mechanism under the treatment with the TECAR device, to understand what gene and protein are involved in the increase of microcirculation, of the increase of healing process. So this is very, very interesting.
And the last study, the last cell study, So they used the TECAR current to see if they could have a positive effect to regulate the antisenescence pathway on fibroblasts. And the conclusion was to work on they could have good results on remodeling the extracellular matrix. And the TECAR current could also promote the tissue renewal. So it means that they could reduce the things of skin aging. So that's the next part that we will explain about the aesthetic effects. So that's good because that's at the cellular level, not only from the other side. We can say, okay, we see that you have a better skin, but it's also inside. So that's the transition. Let's speak about the studies on the aesthetic effect. In this study, they work on the subcutaneous fat loss on 20 patients, both sexes. And they use the TECAR to measure, to analyze it by the a magnetic resonance imaging. So you can see the MRI image on the right side. And the conclusion of this study was statistically significant effects on waist circumference and subcutaneous fat. And you can see that they used the 1 megahertz current. So that's, if you remember, that's the frequency that we use when we use the mixed electrodes. So that's the one which will stay the most superficial. And now what we want is, okay, we use the 1 megahertz, but we use also the 500 kilohertz to work a little bit deeper. So that's our new concept, the Care Plus. So I'm happy to introduce you the new concept that we've launched. You can see the results, the before and after, only one session. And those results come from the fact that we use the TECAR current, but also we combine the electromyostimulation and the heightens for the skin's tightening. And the high EMS help us to drain, to tone the muscles, where at the same time we put the TECAR currents, and you saw just before that the TECAR current has an effect directly on the fat. So that's why this combination of all these currents that we now have with the new generation of Winback TECAR, that's why we have some very good results on only one session again, because we combine the TECAR current, resistive current, plus the electrostimulation, plus the heightens to tighten the skin. And so what about the placebo effect? Because that's something that's also a question that we could have. So you will see that there are also some studies which just worked on this placebo effect. In this study, they used the tecartherapy on gastrocnemius and quadriceps muscles with the spastic hypertonia in chronic stroke survivors. So with this study, what they noticed is the ankle dorsiflexion was statistically significant. The changement was statistically significant compared to the control group. And then they showed significant improvements in the intergroup analysis between T2 and T0. So it's also that's where you could eliminate the bias when you compare the intergroup and intragroup. So that's more the part of Bastien about the statistics.
Yeah, it's more significant to compare in the same group and between the two group and compare each other and regroup the comparisons.
And
Okay, yes, just just because we had just a quick question from Aziz in the UK, asking for Care Plus. So yeah, Care Plus is available in the UK, and Care Plus is for back four. It's really on the model of back four because you know, then you have the double power with the two channels. So you can have a lot of impact and effects with you know, all the three currents combined into Care Plus.
So in this study, they compared with 3 different groups. So they used TECAR, they used HotPack, and it's not a dummy device, it's a sham device. So in this study, they could compare placebo device. So usually they just heat up the electrode, but that's it. They put the hot pack or they put the real TECAR. And this study has been done after the COVID, just after the first crisis, 2020, and they did it on the chest wall mobility. So that's good because that's something that has not been really described. I mean, we don't think about usually using the tecartherapy on the chest for all the breath problems. But the conclusion is the TECAR may be one approach to improve the chest wall mobility. So you can imagine that now, hopefully, we are good with the COVID, but for all the people who have some difficulties to breathe, that's where the TECAR could be an option to help this mobility on the thorax. And for sure, you can see the difference between the CT, the hot pack, and the sham treatments, which is really totally different.
Sorry, before like we move into the next one, just a question for Max. For which mechanism could TECAR reduce subcutaneous fat?
So I mean, it's pretty easy to understand. I mean, if you increase the heat, you will consume the fat. That's just about the calories. So the easiest is to use the fat that you have just under the electrode. So that's how it works, just by the consumption of the calories locally. So I think it's how it works. Maybe it's not the right explanation, but that's the one that I think, because as you can understand, it's just an observation. So they put the TECAR device, they see that there is less fat by the MRI, which is a good observation. After that, what is the real explanation? That's mine. But that's not the explanation that we have from the study. They don't. I don't think when I read it, they didn't speak about. They didn't open the discussion to say the explanation could be like this or like this. So in that one, I like that one because they measure the skin temperature, the ankle mobility, and also the hyperalgia on the myofascial pain syndrome. And it's important. It was in professional basketball players. So at the end, it was on 32 basketball players. And they observed a significant effect on myofascial pain, cutaneous thermal effect that increased with the treatment. But there was no effect on the ROM, so on the range of motion. But remember, I told you it was on professional basketball players. So we could imagine that those professional basketball players, they don't have any problems with their range of motion. So when you have a normal range of motion, it's important. It's quite impossible to increase this range of motion if you are at the maximum of what you can do. So that's why we could just say a little the limit of this conclusion about the no effect on the range of motion. According to our results, the TECAR can induce temperature changes in the medial gastrocnemius. It will increase also the local temperature and decrease the local pain, so that's good. But after that, the range of motion is not changing, but that's normal because that's some super athletes. So that's why we can observe any changement on the range of motion. But I'm quite sure you all have observed the changement on the range of motion on some people who have some lack of mobility. And that one is again to work on the placebo. 50 patients. What they observed is on the shoulder impingement, and it's also with the sham treatment. And we can see that there is a big difference. It's with the constant observation on the VAS. So you can see with the control group, which is in red, compared to the experimental group with the TECAR. So the constant, I mean, it's just to measure all the movements that you can do with your shoulder, is really higher after the treatment. And we can see that the pain has decreased a lot, and the pain has not changed with the control group. The constant score didn't change with the control group. So at the end, conclusion, the TECAR is useful in the useful therapeutic option for the conservative management of shoulder pain, and it could improve the function and the quality of life in patients with shoulder impingement. And
Fred, there is another question from Max.
Okay.
So assuming that explanation, sauna would be great for subcutaneous fat loss, because I don't understand how could that be induced by TECAR. There is another potential explanation, but there is no clinical evidence. The potential explanation is related to the adipose cells. Maybe by putting TECAR, there is a modification of the state of these cells that enter in apoptosis. So this could be an explanation on the effect of subcutaneous fat loss, but in my knowledge, there is no clinical evidence. But maybe this is a potential explanation, because there is some exchange between extracellular part of the cell and intracellular, and maybe there is a change of the state of the cells.
Yeah, and remember, we can change the matrix. So maybe that's also the environment around the fat cells who could also have the effects on the fat cells. So there are a lot of possible explanations. And again, it's just we observed the MRI, and I'm not sure they have done sauna and then MRI, but for sure you won't lose so much fat if you go to the sauna. And let's finish with this last study.
Maybe I'm gonna before we finish, like, I'm going to launch the little quiz, to see like if everybody wants to receive more information, about WinBack.
So during the time that you answer to the question, I can continue a little bit to explain what we did with this case study. So we have combined the TECAR current with the dry needling technique. You know that we are the only one in the TECAR world to use the bracelet and to transfer. We are able to transfer the energy from the bracelet directly through our hands, through our fingers. So that's how we could control the energy directly through the needles. So what we did is with these case studies, we try to put our new currents, the high MS, the high tense currents, and to see what is the results when we use that kind of currents on the human body. So let's continue with the high MS current. So first, the high MS current that we use, it's a medium frequency. So medium frequency means that we are working from 1.5 kilohertz to 4 kilohertz. And with this medium frequency, we can have a pain-free muscle recruitment. So we can have a muscle stimulation. But because it's a medium frequency, we don't stimulate the C fibers, and you know the C fibers are the one which are the most reactive to the electrical current for the pain. To observe these effects of the high MS current, we have done 2 experiments, and we measured with the EMG, with the endurance device, and we have used also we have done it also with the ultrasound control. So with the high MS current with the new BAC 3 TX on the BAC 4, we have 3 main currents, which are the focal at 1.5 kilohertz to recruit the deep muscles. We also have the drain current, 4 kilohertz, modulated in to 3.5 hertz and 50 hertz to accelerate the drainage. And the last one is the radial current at 4 kilohertz. So that's how we could accelerate the drainage and the pumping effect on the vascularization. So what we did is in this first experience, we have used the high MS radial current. As you can see, we have done that on the one patient who has a ACL surgery. And what we did is we have used the high MS current, like you see in the video, directly through the needle. And we observed the effects directly from the echo ultrasound, and also with the EMG to see directly what is going on before and after, directly on the quads. The observation has been done on with the radial high MS stimulation directly on the femoral nerve, on the motor branch of the vastus medialis that we have observed. You can see directly with the echo ultrasound, and that's the curve that we see with the EMG. And here are the results. So the results is with the stimulation with 10%, only the intensity was only 10% of this high EMS radial current. We had a higher level of activation. So it's the percentage of the maximum voluntary isometric contraction than any other exercises, because what we ask to the patient is to do some squat, to do some isometric contraction or knee extension. And all the time, the stimulation with the high MS current was higher than all the other exercises. And then we also did another experiment with the high tense current. So just to show you what is the high tense current. So high tense current is a high frequency current So it's the 0.3 megahertz, but we pulse these high frequency currents in low frequency, 2 hertz, 5 hertz, or 25 hertz, to combine the properties of the low frequencies currents, which is mainly the pain management, to saturate the nociceptors, but also to have the muscle twitches. Muscle twitches is just an isolated contraction, muscle contraction that we could have. If we imagine 2 hertz, we have 2 contractions per second, or 5 times per second if we use the 5 hertz. So that's the high tense. And the objective of this experience was just to use the high EMS stimulation, the high tense stimulation. What is tick, tick, tick. Okay, sorry, it's just I just swap. Do I switch one slide to another one? So that's the conclusion of the study about the high EMS. Sorry, guys. So the conclusion with the high EMS stimulation, we improved the activation of the vastus medialis after treatment. So remember, it was for the ACL surgery. And we had 9% plus more symmetry of activation in the squat movement. And the recruitment of the vastus medialis increased from 60% to 70% after stimulation. So that's just, I'm sorry, I just did a mistake in my PowerPoint, but that one is about the high EMS treatment, the electrostimulation. And what is really important to keep in mind is the activation is better when we use the high EMS current. So about the second experience with the high tense current, we observed that the effect of the high tense currents on the trigger point. So you can see that we have put this needle directly on the trigger point on the trapezius. And the objective was to determine if there is any possibility to decrease the neuromuscular activity by using the high tense 5 hertz current. So what we did is we asked to the patient the day before to perform a pre-fatigue work on the dumbbell shrug. So you know the dumbbell shrug is just to raise up your shoulder a lot of time like this and until failure. So with this, because it was the day before, we was quite sure that the patient will have like a muscle tone on the trapezius increased. After that, the next day, we measured the resting neuromuscular activity on the right and on the left upper trap. The stimulation with the 5 hertz current performed directly, as you saw in the video, directly in the trigger point. And before we were sure to be in the right position with the ultrasound control. And then the resting neuromuscular activity has been controlled by the EMG. So you can see that's the before the treatment. And you can see on the first curve, the tone is really higher compared to the left side, which is the control side. And after the treatment, you can see that we are in the relax zone because we have zoomed. So that's why you can see here we are in this range. So we consider that when you are in this range with the EMG, you are in the relax mode. So for sure, you are just a little bit higher than the left side, which has not been fatigued. I mean, there was no work on the left side, so that's why it's lower. But after one treatment, we can see a very clear reduction in basic tone, allowing the patient to return to the relaxation zone. So that's the experience that we did to prove that we could have a significant reduction of the activity after using the high tense 5 Hertz in less than 1 minute. So it was really quick treatment. So that's how we could combine the high tense and the dry needling. But you could imagine that even you don't use any dry needling techniques. If you use only the high tense currents, that's how you could reduce also the tone, and you could break down all the contractures that we have all the time, all the days in our practices. So the conclusion of those two experiments with the high EMS current, we could see that we have a higher capacity in the voluntary exercises, on the possibility of improving the activation symmetry, which is really important when we speak about ACL surgery. If you could have a symmetry between your two quads, that's for sure better. And this leads us to believe that the high EMS current could be used post-operatively to relieve sedation or during rehab to improve the muscle activation. And also about the high tense. So about the high tense currents, these experiments are very promising as regards its used in the case of trigger points to regulate the neuromuscular activity to make these trigger points yield. So that's the conclusion of those two experiments with these new currents. So that's just a case study, but for sure we will do more and more studies about those combination of TECAR plus IMS plus high tense currents. Okay.
Okay.
Here we are. Is there any questions before we leave? So I hope you enjoyed this webinar, which was a bit new, but the subject.
So we have a question. Do you have a QR code where we can access a list with links to all the studies discussing in this presentation? Yes, the webinar and the presentation will be available on the Academy platform. So you can register and have access. So everybody was saying thank you. Thank you for staying connected. I know it was a dense and long webinar, but everybody stays. So thank you. And also, thank you for Fred and Bastien for putting that together. It was amazing work done by the Academy. It's really, it's just the beginning of a new journey when it comes from studies. So thank you, everybody, and thank you for listening with our French accent or in English.
And stay connected. Tomorrow you will receive the replay again. So with this replay, you could take the time to read all the informations, to scan the QR code that we just put on the presentation if you want to have more information to go more in the details, to look at all the studies in detail on the net.
Thank you, everybody. Have a wonderful evening or day or early morning for some, or night.
We don't know.
We don't know. Thank you, Bogdan. Bye, everybody.
Bye. Thank you.
Bye-bye. Thank you.